Hello, good morning once again. This is Dr. Latuno from LA, and today we're gonna talk about stroke or brain attack, just like having a heart attack, but this one is in the brain. And sa mga aking kabayan, Filipino subscriber, again, panoorin niyo yung second part kasi I'll try to translate sa Tagalog yung sa second part na itong discussion na to. And okay, let's start. Stroke or brain attack. This is the second leading cause of death worldwide. Symptoms, usually you'll have a facial droop, meaning the left side or right side of your face is numb or weak or paralyzed. And then sometimes you cannot talk, or you have slurred speech, or severe dizziness. And then the types, number one is ischemic stroke, where the brain artery is blocked either by severe atherosclerosis or a blood clot. And number two is yung hemorrhagic stroke, where there's the small artery in the brain burst, leading to bleeding. And number three, we call it TIA, transient ischemic attack, which is a transient disruption of the blood supply to the brain, most likely from an embolus. Okay, risk factor for stroke are hypertension, diabetes, high cholesterol, lack of exercise, and also smoking. And special mention is a condition called atrial fibrillation, where the small chamber of your heart is not contracting properly, and this is seen in the EKG. If you do an EKG, there will be no P waves in the strip. Okay, first thing to do when you have symptoms, of course, you have to call 911 or bring patient right away to the hospital, because in a stroke, it is important, and the first assessment is time. Usually there's a window of less than 4.5 hour window to be able to qualify for thrombolytics, especially TPA that we give in the hospital. But there's a inclusion-exclusion criteria for TPA, and there's so many of them, but I'm only gonna mention 3 of them. The most important is that you're not actively bleeding anywhere, brain or any part of your body. 2, if you have a persistent elevated blood pressure, your systolic is equal or greater than 185, or your diastolic is equal or greater than 110, then you don't qualify. Or if you are on any blood thinners like Lovenox, Eliquis, or Xarelto, then you don't qualify. But if you qualify, then they have a protocol for TPA. They'll give it IV, but you have to be admitted to ICU. But first initial assessment is to do CT scan of the brain without contrast. Make sure you don't have any hemorrhagic stroke. Okay, number 2 is MRI of the brain. And number 3 is CT angio of the head and neck. And if you don't have contraindication for CT angio, like you're severely allergic to iodine, they can do MRA, which is MRI of the artery of the head and neck. And then EKG to make sure you don't have atrial fibrillation, and then echocardiogram, next step, and then blood test for lipids, CBC chemistry, ProTime, and PTT. Now, if you have a hemorrhagic stroke, then we cannot give you any aspirin or blood thinners. And then plus, if you have high blood pressure, we have to treat your hypertension aggressively. But if you don't have a hemorrhagic stroke and you have ischemic stroke, then we usually give you aspirin right away, 81 milligram once a day. But you make sure you can swallow by doing a bedside swallow eval. And number 2, we give you high-dose statin, either simvastatin or Lipitor, 40 to 80 milligram. And then if you have hypertension, we allow permissive hypertension for 24 hours, meaning if we allow systolic blood pressure range from 161 to 200 for 24 hours. And then the next step would be to be evaluated by speech therapy for swallow test, and then if you have persistent weakness, either left or right, then you need to be seen by physical therapy and occupational therapy. And then if you have TIA, we give you aspirin, but on top of that, we give you also Plavix for 21 days to prevent to have recurrences of stroke. And if this is your second stroke and you were on aspirin before, we add Plavix too to prevent, again, recurrences of stroke. Of course, the next step would be, if you're already stable, then next step, if you have persistent weakness, then you need either go home with home physical therapy or go to a rehab center for rehabilitation. And that's it for now. And now I'm gonna try to translate this in Tagalog to my Filipino subscribers. Pasensya na kayo kasi minsan mahirap i-translate yung mga medical term in Tagalog. Pero stroke or atake cerebral, ito yung pangalawang cause ng pagkamatay sa buong mundo. Ang mga simptoma nito is yung namamanhid or paralyzed yung left or right side ng mukha nyo, or pagsalita nyo para kayong bulol or hindi kayo makasalita, or meron kayong severe weakness or paralyzed left or right side ng katawan, or sobrang pagkahilo nyo. Ang mga type ng stroke ay tinatawag naming ischemic stroke, meaning yung artery sa brain ay na-block because of yung severe atherosclerosis or may blood clot. Ang pangalawa, yung hemorrhagic stroke, meaning may bleeding sa brain dahil yung artery sa brain nag-burst. Ay yung pangatlo, yung tinatawag na TIA or transient ischemic attack, meaning temporary lang yung symptom mo, after ilang oras nawawala dahil yung blood clot na dissolve kagad. Ang mga risk factors sa stroke ay number 1 is high blood pressure. So kailangan kung may high blood kayo, kailangan makontrol talaga yung blood pressure para hindi kayo ma-stroke. Pangalawa, paninigarilyo. Pangatlo, diabetes. Pang-apat is high cholesterol. Pang-lima, lack of exercise. And yung special mention again, yung tinatawag naming atrial fibrillation, which is nakikita sa EKG, yung small chamber ng puso ay hindi nagko-contract properly. Of course, pagka meron kayong simptoma ng stroke, ang kailangan gawin dito sa Amerika, tumatawag kami 911 or sa inyo, ambulansya or daling kagad sa ospital para magamot kagad. Very important yung time kasi may window na tinatawag na less than 4.5 hours na oras para maggamot ng mga blood buster na tinatawag na or thrombolytics, like yung TPA for short. Kailangan makita kagad kayo, pero kung more than 4.5 hours, hindi na kayo qualify sa gamot na to. Tsaka ito may mga criteria para mag-qualify. Unang-una, kailangan wala kayong active bleeding sa katawan, sa ulo, sa tiyan, or yung blood pressure nyo kailangan hindi mataas. Like yung unang number, yung systolic, kailangan hindi persistently 185 and above, or yung diastolic, yung pangalawang number, equal or 110 and above. At pangatlo, pagka meron kayong ininom na blood thinner, like nabigyan kayo ng Lovenox or naka-Eliquis kayo sa Xarelto, then hindi kayo magka-qualify sa TPA. Ang unang test na ginagawa namin sa hospital ay sa CAT scan of the brain ng without contrast para malaman na hindi kayo nagbi-bleed sa brain. Ang pangalawa ay MRI of the brain. And pangatlo yung tinatawag naming CT angio of the head and neck or MRA of the head and neck. Tapos of course EKG, echocardiogram, and blood test, lipid, CBC chemistry, ProTime, PTT. At kung meron kayong bleeding sa brain or tinatawag na hemorrhagic stroke, bawal bigyan kayo ng mga blood thinners, of course, like aspirin or Plavix. At kung meron kayong high blood pressure, kailangan gamutin to ng aggressively, pababain, kasi to prevent further bleeding. Pero kung hindi naman kayo nag-qualify sa TPA at wala kayong bleeding sa brain, we usually give you aspirin, baby aspirin, once a day, but sinisigurado mo na kailangan makakalunok kayo. Pangalawa ay yung high dose na statin, like yung simvastatin or Lipitor, usually from 40 to 80 mg once a day. Tapos kung may high blood kayo, inaalaw namin ng blood pressure to range between 161 to 200 for 24 hours. At pangatlo, kailangan nyo ng swallow test ng speech therapy. And panglima, yung kung meron kayong persistent na weakness sa left or right, then yung kailangan nyo ng physical therapy and occupational therapy. Also, pagka may TIA kayo, usually ini-start rin namin kayo ng Plavix on top of the aspirin to prevent yung pagbabalik ng stroke. Or if itong pangalawang stroke nyo na, then kung naka-aspirin kayo, dinadagdag namin yung Plavix. Okay, and then the next step, of course, kung stable na kayo gumuwi, kailangan nyo ng rehab sa bahay or sa rehab center. Alright, that's it, folks. Salamat sa pagkinig sa aking munting vlog. Kaya kung may mga tanong kayo or question, i-message nyo lang ako. And don't forget to subscribe and like. Again, Dr. Latuno. Again, disclaimer alert, my topic is not comprehensive regarding stroke. I'm not going to discuss everything about stroke and treatment. And again, if you have symptoms of stroke, you have to call 911 and go to the nearest emergency room. All right, goodbye. See you later for my next vlog. Okay, peace out.